Good morning, everyone. I hope you all had a happy Mother's Day for those of you who are mothers or grandmothers or whatever. This is our community conversation for May, and we have, as usual, our board member Dale Reisner, who is the medical director of OBGYN quality and safety in the Swedish system here in Seattle. We're also going to have Salomé Valencia-Bohné, who is a social worker and clinical therapist, and she's going to be talking with us about mental health and COVID. So first we'll have Dale go over some of the current information around COVID, and then after that, Salomé will give us a little talk on mental health. And if you would put your questions in the chat, we probably can also take some hands at the end of the conversation, but if you have burning questions while they're speaking, put it in the chat. And we are recording, and this does have one CE for the BCPAs on the call. So with that, I'm going to let Dale take over.
Well, good morning, everybody. I hope those of you who were celebrating Mother's Day yesterday had a nice day. We all have mothers or had mothers, and many of us are mothers, and so we can appreciate the sentiment of that day. Since I'm a maternal fetal medicine doc, I celebrate mothers all the time because that's my job. So what we focus on here has to do with COVID a lot, but best outcomes with healthcare. It's part of what we do for HealthAdvocateX, and what I think the majority of the people that are on the call do as health advocates. And certainly if you are a member of the public that is on the call, you are concerned about health advocacy as well. It may even be for yourself or your family. So just welcome to everybody. We are 2 years and plus into the pandemic. It's still a pandemic in case people kind of want it to not be. It still is. We talked about that in the past based on the number of cases per 100,000. So it's going to take a while to convert to endemic. It will become endemic, where it's just part of our everyday life. And I think we're realizing that we're treating it, many people are over treating it as endemic because we're seeing cases increase, and each variant has become more infectious, although apparently not quite as deadly. So that's the good news. What I'll do is just start with some data. I want to highlight a couple of things, and definitely want to hear Salomé's presentation with a focus on effect on children and the work that she does. And then we'll take questions at the end. So as per usual, I'll start with global. We are almost 517 million cases in the country, and that's tested cases, right? So it's clearly more than that, and more than 6 million deaths. And in the United States, we're close to 1 million deaths with over almost 82,000 confirmed cases. When we look at those cases, we also want to think a little bit about vaccination rates. It's improved in the United States as a whole. 63% of the adult population are fully vaccinated. And I'm not going to break down the pediatric rates, but we know that they're a little bit lower than that because it's taken a while for the vaccinations to be authorized by the FDA for younger children. And almost 78% have received at least one dose of vaccine. The other thing that I wanted to highlight is that there are pockets of fairly high transmission. In Washington State, we are in a category that's not high transmission, but the one next to it, which is fairly significant transmission in the community. for that reason. Many places that you will encounter in healthcare still are being super careful. We're starting to see actually more caregiver infections again, more sick calls, and so on. So the things we've talked about in the past about staffing in different facilities, and you'll see it in stores everywhere as well, trying to get enough people to work who don't call in sick and to keep places open, I think is going to be an ongoing challenge, assuming that we, still have fairly significant transmission. I'll just highlight this Florida and New York in terms of overall number of cases. There are also pretty highly populated places. Texas, it's spread out, but it's a big place. And the places have high population. It also maybe a little more vaccine hesitancy. Even in Washington's bubble, if you look at overall cases. And then what's really quite fascinating is along the eastern seaboard and into part of the Midwest, the kind of more eastern part of the Midwest, we're seeing higher as well. So we'll, talk a little bit about that, but I did want to mention that we still have racial disparities in our cases, in our vaccination rates. And when you look at the African American population, the death rates that have been reported across the entire pandemic time are much higher than their population density in the United States. It is interestingly lower than any other group is the Asian population, where they have pretty high vaccination rates. Also, their death rates have tracked lower than their percentage of population, and everybody else to high
Hey,
percentage
Dale.
of the population. Other than
Dale, you're a little
Yeah.
spotty. I'm wondering
Weird.
whether it's somebody suggested maybe if you just turn off your video. I don't know if that would change it, but you're kind of
I
cutting in
can
and
definitely
out.
turn off my video. Yeah. I don't know why it doesn't look from my end that it's spotty. So sorry
Okay.
about that.
That's okay.
And I'm about to finish up. So I just wanted to mention those disparities because that's really important. And the other thing we've talked about in the past is in the pregnant population, there has been vaccine hesitancy, and amongst that group of people in our country, there's new information that really shows that education does pay, and that this is a population that their vaccine hesitancy has really been fear for their baby. And so getting information out is a little bit different than other portions of the population that may have a different reason for being hesitant. Like don't trust healthcare is a really common one in the African American population. Some people don't trust the mRNA vaccinations, that kind of thing. And then just one other thing about vaccination before I leave and turn it over to Salomé is that you may have seen the CDC did issue a warning recently on the J&J, so Johnson & Johnson vaccine. It is not messenger RNA vaccine. It is formulated more closely to the other types of vaccinations that we're used to in this country. It's been great because it's a one-time only, and yet there have been reports of blood clot complications and death from blood clots with the Johnson & Johnson vaccine. So first of all, the risk is incredibly low, and there's risk of clotting complications with the wild virus as well, right? So we've seen this with COVID. We saw this early devastating complications from COVID, the wild disease. From the Johnson & Johnson vaccination, just to put it in perspective, there were slightly over 3.2 cases of fatal blood clots per 1 million vaccines given. incredibly low risk. However, those cases got a lot of press. So the warning is that Johnson & Johnson may be great for patients who had prior severe allergic response to the mRNA who want additional dose. If the mRNA vaccinations are not available, which happens in some rural areas and in some countries where refrigeration is and freezing is more of an issue. And also for those who are hesitant to take one of the mRNA vaccines. So just if you hear about it, I think it's really helpful for you to understand the risk is incredibly low. This is a very cautious move on the part of the FDA. So I'll leave you with that. And if there's questions at the end, we can certainly address them, and want to turn it all over to Salomé.
Thank you, Dale.
Thank you, Dale. That's wonderful information to have. And I'm just putting my bio into the chat, just in case people want to be able to read it rather than listening to me talk nonstop. And my contact information is also there as well, in case you have any follow-up questions that we don't have enough time to get to today, or if you want additional resources. I'm a social worker, and so I always have a lot of resources. So feel free to reach out. So a little bit about me. I originally got my master's in international care and community development with an emphasis in health and mental health. And I did that because I really wanted to understand the business portion of how the healthcare system works, and how do I step in and provide that change. Oh, do you have a question, Charmin?
Sorry, didn't mean to have my mic on.
Okay.
Yeah, if everyone could please mute, that'd be great. Thank you.
Yeah, no worries at all. Happens to me often. And so, yeah, so I did that. And then I went and I got my MSW, so the Master's in Social Work with an emphasis in clinical social work, so health, mental health, that the hope of integrating that approach and looking at people holistically at the University of Washington. And since then, I've been working in the community in a variety of ways. I do my best to have a micro and macro approach. Micro doing more individual therapy, macro working on boards, advocating and supporting different legislative I don't know what to call it, legislative change, I would say. Really a strong focus on change and increasing equity. And so I, again, have been very fortunate that I've been able to work both in the micro and the macro levels. I am a therapist at Peaceful Soul Healing for my micro work, and for my macro work, I am the president of the Washington State Society for Clinical Social Work and the president-elect for the Coalition of Healthcare Social Workers. And I sit on a variety of other boards that you probably are as interested in because they're less therapeutic inclined. And so, again, if you want more information about me, you're welcome to jump over to my LinkedIn page or to just send me an email. So some of the questions that I normally get is, why do you do this work? You do a lot of different things, and what drives you, what motivates you? And I would say that it really started in my formative years when I was with my family. I am Latinx. I don't know if many people know that. And my family's originally from Mexico. And I was going to be raised there. I was born in the US, but we went back to Mexico, and I was going to be raised there. My grandmother, she had cancer. And we found out she had cancer, so we had to move back to the US. And so I was raised here in the US. And being here, having family that are first generation, that are immigrants, and seeing the health disparities, and not understanding at that young age, why is it that our lives are so different. I could go to a public school with someone that was quite wealthy, and I'd go to their house, and I would just look around, and things that they would take for granted, I would wonder, well, what is so different about us? We both are receiving the same education. We both come from good families. And so why is it that they have so much and my family has so little? And I was very fortunate that my family was able to work here and to have the paperwork in order to be able to be here. But not all of my peers had that same ability, that their families were here because their parents really wanted them to have a strong education foundation. They really wanted them to have more opportunities than what they had when they were in their native countries. And so also seeing the difference between us as well. Why is it that I have more and they have less? We're just barely getting by, but they're on the brink of just barely surviving. And so just constantly seeing that these systems at play aren't supporting the people that they say that they're supporting. And the values that we as Americans say that we hold aren't always being uplifted. And how do we lean into those and have conversations to better understand and to see the barriers that are in place so that we can be able to be in community, to work alongside one another and uplift one another's voices. And so all these questions would come up and do still come up in various forms in my lifetime. And one of the reasons why I decided at a young age, at like around 4 or 5 years old, that I wanted to be a therapist was because the only contact that I had with any working professional were teachers and TV. Occasionally, you know, I would have that contact via the hospital, but it was more my mom interacting with the doctors for my checkups, etc. And on TV, I would watch Frasier and I would watch Who's the Boss, and seeing these brilliant, vibrant people and how they would solve problems through talking, I thought that was remarkable. I didn't know that way of living and being in the world was possible. And so then I decided I'm going to be a therapist. And from that age going on up, when people would ask me, I'd always tell them I wanted to be a therapist. And so in the 6th grade, I was very fortunate to earn the Gaining Early and Awareness Readiness for Undergraduate Programs Gear Up Scholarship. And then in high school, I was also very fortunate to earn the HAP and the Achiever Scholarship. And all of those within my essays always shared that I want to be a therapist, and these are the reasons why. And I was very fortunate to be able to get my various degrees and to learn and grow and understand that you can't practice therapy if you just have a BA in psychology. So that was another thing, just the first gen experience of learning everything for myself and my family, and experimenting and trying my best to navigate this very beautiful and wonderful world, but also very confusing world. And so with that being said, I was very fortunate that after I received my MSW, I was able to practice in the community as a therapist for a variety of different organizations and to continue to carry that heart and passion for advocacy. And so I was very fortunate to join various boards and to be able to continue to support Latinx therapists. One of the things that I wanted to be able to share with all of you are some of the resources that I was fortunate enough to collaborate with other people on and to share with the public. Dale did a phenomenal job of sharing that there are health disparities, and those health disparities are there for a reason, and they have a lot of historical rationale and reasoning behind it, and not only historical but also present day as well. When I worked at hospitals, it would be hard for the doctors to understand and want to support and navigate the complexities of the cultural differences that their clients were bringing into the room. And for one example is that the doctors would just want to have a conversation just with the parents, not understanding that the grandparents as well wanted to be involved in the conversation, and that the family dynamic included the grandparents, because the grandparents also lived in the home. And so there was always these different things that the doctors, the nurses, the various staff struggled with in creating a more supportive environment for BIPOC communities. And so one of the things that came out of that, and then also came out of a partnership with the Latinx Health Board and the Community Health Board Coalition, and I'll paste those links into the chat box so that you'll be able to learn a little bit more about them. But what came out of that was the Mental Health and Wellness Toolkit for Latinx communities. And this was just a phenomenal, these are some great people that I was able to work alongside in creating this. But this was just a phenomenal experience to be able to look through the lens of the Latinx community and creating a culturally appropriate and supportive and sensitive wellness toolkit that they would be able to have a lot of their questions answered. For example, like as someone that hasn't gone to therapy for the first time, what should I expect? How do I get childcare or transportation to help me get to my appointments? What are my rights? If I need an interpreter, can I ask for one? And so some of these questions people would consider to be like very, very simple. But in actuality, because there's such a big stigma around mental health within the Latino communities, these are honest questions that people are trying to navigate and some of the hurdles that they're trying to overcome.
And Salome, I'm wondering if during the COVID crisis, if you saw, I mean, if you can talk about kind of how you wove your mental health skills into helping both adults and children during that time.
Yeah, no, I'd be happy to. And so for the wellness toolkit, this was shared with various mental health agencies as well as with the Community Health Board and the Latinx Health Board to share amongst other communities that may need the additional support. And this toolkit incorporates how to support adults and how to support children. And the hope is that eventually that this will transition into having its own wellness toolkit just for children, but it has some information as well. And so there is, let me see, I'm going to stop sharing and then I'm going to go over. So thinking about how do you show up, how do you support the various people that come to you, because everyone has different lived experiences, different intersectionalities. It gets really complicated. And so one of the things that I love to also share are just book recommendations. So the 104 activities that build, this supports self-esteem, teamwork, communication, anger management, self-discovery, and coping skills. I don't know if anyone can see it. It might be a little blurry because of my background's blurred out. And looking at the ways in which how do we invite play? How do we invite co-collaboration? And how do we invite increasing a child's autonomy and understanding their developmental stages and meeting them where they're at rather than meeting them where we feel comfortable? And I know that sounds a little strange, but one of the things that I really like to think about is our children, our babies, our young adults are all people that have their own hopes, dreams, and desires. And so how do we walk alongside them and support them in gaining that independence and developing into these well-rounded individuals, and provide them with a future that is different than what we may have experienced? And as we see our children grow, also processing the different memories or the different emotions that come up with that. For example, I had one client that had a hard time with seeing their child grow, and they would be triggered when they would see their child interact with other children that were more well off. And so working with that client and being able to understand that this is something that they carry and to process why they carry those memories, those emotions, so that when they were interacting with their child, they can provide their child with a space to be able to share what they're experiencing, share what their hopes and dreams are, and how they're building that friendship with that person. And so really seeing that child as their own individual and being able to support them as they continue to develop and grow in this world. Also encouraging people to have conversations. Oh, I'm so sorry, Beth. Were you going to say something?
I was just going to say, we saw as advocates, a lot of us had the issue of, trying to help adults who were in COVID situations that were really challenging. And I'm wondering if you could speak to some of the issues you've seen with children and how to best navigate those. And maybe that's what you were just going to talk about.
Yeah, yeah. So one of the things that I try to support with when working with children is something that's called PACE, and I don't know how many people are aware of that, but it's playfulness, acceptance, curiosity, and empathy. And it's really meant to support and promote the experience of safety in one's interactions with young people, and also to be able to provide children that basis, that foundation to be able to explore what feelings, emotions that are coming up for them during this very scary and strange time. For instance, one of the drawbacks, there's so many drawbacks, but one of the downsides, drawbacks of COVID is that children aren't able to have a consistent environment, to have that structured environment that they had previously. And so how do we create that within our homes? One of the ways that we can do that is to create a daily schedule and to work with our children in being able to develop an understanding of why we have that consistent schedule, and also to invite conversation. How do they want to contribute to the schedule, and encouraging them to invest in developing it. For instance, if they wake up and their day originally started at 8 a.m., well, how can you support them with trying to maintain those same sleep routines? Disrupting the sleep routines can also cause a lot of other concerns throughout the day. For instance, they might be more irritable. They might be more or less inclined, I should say, less inclined to be able to engage in conversation. They may just want to just lay there and focus on tech, focus on TV, what have you. Also thinking about tech, like how do you want to have a conversation with them around how much tech time they're going to be receiving during the day. If it was a typical school day, they probably wouldn't get very much. They probably at most after school, you would have a little bit of tech time, a little bit of TV time after they're done doing their homework. And so really thinking about having those conversations around that as well. And so trying to, again, have a consistent schedule, trying to have a conversation with them about what would that look like. If you have what does PACE stand for? It's playfulness, acceptance, curiosity, and empathy. And I'll paste that also into the chat box. There you go. And so looking at, again, partnering alongside your child, having conversations. Granted to say that that doesn't mean that that they are then running the show and that you take a step back and you no longer parent them. That's not the case at all. But it just means that they have a little bit more conversation with you. Sometimes we find that with children, what was developmentally appropriate, like let's say a few months ago, is different a few months later. So they may have a little bit more cognitive awareness and ability to have a conversation and to logically understand the pros and cons of a certain situation. And so making sure that you have that ability, that time to check in with them. A lot of children during this time, because there's that disruption to their normal routine, they are experiencing a lot of anxiety. They are experiencing various forms of depression. They are experiencing, depending on the situations that they've had in the past, PTSD. And so recognizing that it's not them trying to act out, it's not them trying to make life difficult, it's just them trying to make sense of the world and trying to process the internal turmoil that they've been experiencing. And so having a little bit more empathy and patience, while it is hard because you yourself, as a parent, as a caregiver, might be very stretched very thin, but trying to have that patience approach with children, recognizing that they too are also experiencing a lot of turmoil in their own lives.
Mhm.
I see here that we have a question for Dale, so I'm going to leave that for Dale for later.
Okay.
I'm wondering if anyone has any questions so far with what I've shared, or if there's different kinds of situations that have come up for you that you wanted to talk through before I continue.
Oh, I was really interested in the anxiety and depression piece because I think that we hear about that all the time, especially in adolescence, and adolescence seems to get younger and younger all the time. So I was just curious about what kinds of resources, and I'm sure going to therapists is probably one of those, but some good resources for how advocates can not just help because a lot of advocates don't work with children, but they're working with the families of children. So how to help the families deal with what's going on.
Thank you. Yeah, no, that is a wonderful question, and you're right. More often than not, depending on how much the behaviors, the emotional well-being is affecting the child's ability to do what they to stick to the routines, to function as they typically would, um, it can it can be very difficult, especially when families have during COVID not only trying to do school at home, also trying to work, also trying to take care of the other responsibilities that are happening. Um, I see a lot of families that are overwhelmed. They're juggling so many different things, and they themselves don't have a lot of sleep. They don't have a lot of rest. They don't have the chance to renew themselves as might have. I say might, pre-COVID. And so one of the ways that I try to encourage people to explore supporting the family is to think in terms of developmentally, what additional responsibilities can the child take on? Developmentally, how can that child be included in conversations? And how can you have um, time? And time is so hard to come by nowadays, but how can you create the space to have a conversation with them to help them understand why things are the way that they are? Children are very smart. Adolescents are very smart, and they see what's happening. And rather than them learning from other people at school or via TV or the media, instead having that conversation with them so that it's coming directly from you. Also, I completely recognize that during the teen years, it is a very hard and difficult time with all the hormones changing and roles changing and the dynamics at school also, and the additional responsibilities that they have to navigate at school. And so I recognize that can be a very tense time. Um, and so also looking at if they are fortunate enough to have a therapist, partnering with that therapist and having a conversation about before they enter in that relationship with a therapist, having a conversation with your child and with the potential therapist that you're interviewing to build that partnership, determining what would that look like. Having a conversation ahead of time with your child who's 13 years and up about how can you partner with them? What information do they feel comfortable sharing? Do they want to have a conversation with you, the therapist, and them in the room, and just have it at that, of them giving it your child giving an update? And so trying to navigate those nuances ahead of time. And then if things do change, because your child, if they are 13 years or older, they don't have to share information with you that's happening in that therapy room. And so if they do decide that that's not something that they want to do, or if they decide to not share sensitive information that you think might be very important for you to know, then having a conversation of like, what would that look like if it does come out later, and how would they like to be approached? Also having a conversation with them about what are your coping skills? What are some ways that I can support you when you're in this certain space, and I want to help reduce whatever those symptoms are, or I want to find a way for us to continue to collaborate and have a conversation when you're feeling better. And so identifying what those coping skills are. If during those times you find that your adolescent is not able to use those coping skills, does not want to use those coping skills, then perhaps exploring different coping skills when they're feeling more grounded, exploring different coping skills to help support them, because that list is intended when they're to be created when they feel more grounded and more able to have those kinds of conversations. I would not recommend when your child is in a space where they can't have a logical conversation to say, hey, let's create a list, because they're not in that space to be able to create it. I would recommend having that conversation ahead of time and encouraging your families to have that conversation ahead of time. It may be that you are supporting that conversation in that room, or you are supporting that parent with being able to prep and to practice before they have that conversation, but still having that conversation ahead of time. And then also having a conversation with the parents ahead of time of, you know, what are you doing to take care of yourself? Granted, you don't have a lot of time, you may not have a lot of resources to do so, but what small steps can you take to take care of yourself so that when your child does show up with not having a good day, or experiencing something horrible, like how can you show up to more regulated to support them?
Mhm.
And so some of the things that I do encourage them, parents to explore, is just looking at their routines, looking at, if they only have like a 10-minute break between meetings, or 10-minute break before it was they're driving to, and I say break, but as they're driving to work, what music, what experiences can they have as they do that? It might be that they're switching from having caffeine to having coffee, to having, caffeine-free tea, but one that is more fulfilling and supportive of their overall health. It might be that increasing their water intake. It might be having a snack, or having various healthy snacks, or a protein bar spread throughout their workstation or their car or what have you, so that they have something to snack on rather than running on an empty stomach. Exploring, if they only have time in the evenings to be able to feel grounded, then looking at, okay, well, you have an evening, how can you sit down, maybe for 5 to 15 minutes, the activities that you know that you have to get done and you will get done, but setting it down briefly so that you can center yourself through a mindfulness activity or through meditation. There are a lot of different YouTube videos out there that you're able to explore. And then also just looking at some simple things that you can do. I'm going to paste into the chat box one video that helps people get grounded. And also looking at, if you don't have a lot of resources around you, how can you practice with your family different kinds of calming activities to reduce anxiety and stress. And some of these activities are just really short, like maybe 3 to 5 minutes. One of those resources I'm also going to paste into the chat box as well. It's a YouTube video on tapping techniques, and it's very, very simple to do. But doing that as a family, and also building those healthy habits with your children, to be able to recognize what they're experiencing and to be able to accept it, but also through accepting, recognize that they don't have to feel that way forever, that there are different things that they can do to help regulate their internal systems. Oh, yes.
Great. Thank you. That's a lot of information. I just want to make sure we have time for Dale to jump in and answer some of the questions about the boosters that have come up, because I know Dale sometimes has to run. Michael Wood asked Dale how you view a second booster, given the Israeli study that showed that infectivity protection is nearly gone after 8 weeks post-booster. And are there any new data on second boosters decreasing the risk of hospitalization and death?
So I'll try this with my video on and see if this works.
Okay.
Yeah. Just signal if it's spotty. So it's a great question, and it's something we are looking for more information on for sure. The waning protection is a fascinating subject. There's new information out talking about even just getting the vaccine or having the wild virus. and whether that has longstanding protection, even though we can't detect antibodies. So if you look at people who've been exposed and had the illness, mild or severe, particularly with severe, but with anyone who's had it, and also with those who've had a vaccination without boosters, there seems to be some longer term protection than might be considered ideal, but that seems to be out there. The Israeli studies in preprint, I don't think it's been published yet. It's a great study. I'm so thankful that they did it. So senior citizens 60 to 100 years old, and looking at whether a second booster helped them. That was done in 40 days. It was done throughout the country and was included about 500,000 people. So a lot of elderly people in Israel, I guess. And of that, 58% of the population, of this particular population, got the booster, the second booster. So fully vaccinated plus one versus fully vaccinated plus two boosters. That was 290,000 people. There were 92 deaths. In the comparison group that did not get the booster, there were 232 deaths in fewer patients, so 210,000. So the summary on this is a 78% benefit in protecting death with that second booster. So although it doesn't quite make sense because the immunity looks like it's waning, it's apparently doing some work. And I think if you're in a high-risk population, I mean, this is fairly new information, and I haven't had my second booster, but have been thinking about it. And I'm in that high-risk population. So that definitely prompts me to do that. I've been kind of waiting to see what's coming out. The other thing that we don't know about, and I'll just throw this out here in case somebody has a question, is long COVID. So new information, we haven't really had all these other variants for long enough to know if the milder but more infectious variants of the virus are also putting people at risk for long COVID. And there's some early suggestion that may not be the case, but there's not enough data to draw a full conclusion. So I think we still need to protect ourselves. This is, I sound like a broken record for anyone who's been on before. Please, 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 mask in public, enclosed places. You can catch this thing so fast. As I mentioned in the beginning, we're having staff, young, healthy staff out. They're not getting super sick, but they're out sick with COVID, and they're vaccinated. So protect yourself, especially if you're in a high risk setting. Protect your clients as an advocate in the best way you can. And that's, I think, just look for more in the press that will be coming out as we are able to collect more of this information. We're also hoping for future to get an expert in long COVID on as one of our speakers. So that'll be something to look forward to.
Salomé, I'm wondering, I've recently tried to help a young person, not an adolescent, find a therapist for depression, and it is absolutely a nightmare. I'm wondering, when you say, I mean, you probably aren't taking new clients either, but what can you do when you can't? I mean, it's really, there's a dearth of mental health resources, clearly, but when you feel like someone's in need and you can't get a therapist to see them. I know there's, you can call 911, you can call the suicide prevention hotlines, but just in general, it's just really challenging.
Mm-hmm. No, I agree with you. It is. You're right. Calling the crisis connections, the various looking to the various organizations such as the National Prevention Suicide National Prevention Suicide Prevention Hotline, DV hotlines, all of that. People are utilizing that. They are reaching out. They are trying their best to look at what resources do they have access to, and sometimes those aren't enough. And so one of the things that I don't know if many people know about this, but the University of Washington partnered with Verdant Health in developing a program to support people in the community with gaining mental health skills. And it could be anyone in the community. And they through this partnership, they determined that they were going to pay people for their time. And so right now, I think they pay people around $250 to go through the program. And the focus of it is to teach community members various mental health skills so that they can continue to support their community. I pasted the link in the chat box in case people are interested in looking through it. And the focus is to be able to teach some very basic skills so that you're able to show up in these spaces. For instance, if someone is suicidal, how do you respond? How do you provide that support? If someone's self-harming, or if someone is experiencing anxiety, depression, and also the training gives you a sense of what each diagnosis, what's the criteria for that diagnosis, so that you better understand how to support them. And then, of course, having conversations of how do you advocate when you're going into various spaces like a doctor appointment to support your loved ones. Also, on top of that, there are other resources that you can utilize as well. Michael brings up a really good point. There are telehealth counseling opportunities that you'd be able to access. I recognize that there was one in Washington in the King County area that they were trying to start that would be free to anyone that needed that support. I don't know how far along that they progressed, but it was that you'd be able to set up an appointment with a therapist for a one-time period. You'd also be able to set up a time with a doctor for depending on your needs, but typically for a one-time period, and all of it was free of cost. Everything was being donated by that doctor, that therapist. And so I can see if I can find the information and I can send it. But
Yeah, that would be great. Yeah.
I would recommend, like I said, the Mental Health Matters of Washington program in case you're interested in developing those skills yourself. And also just recognizing that it's a really, really hard time. And you are doing the best that you can. You are not expected to come out and perform miracles.
Mhm.
And I recognize that that's going to be hard to do, to accept and love ourselves and know that we're doing the best that we can, because we want to do more. We're in this field because we want to find ways to help support the people that are looking to us. And we want to find ways to change the inequities that we're seeing. And the problems that exist didn't just happen overnight. They have been in
Yeah.
place for many, many years. And the systems that were constructed intentionally. And
Mhm.
so when we think about it in terms of that this isn't our fault, that these systems have been in place and that they were intentionally created to work in this way, then that responsibility that we hold and that we carry, hopefully it will lessen, and that we'll be able to recognize that we're doing, again, the best that we can, given that this situation is not one that we've created.
Yeah. Yeah. We have a question back to you, Dale. What will the summer bring in terms of more rates of COVID? What's your prediction?
You don't like my predictions because they've
I
been
know.
fairly on. Yeah. I think we might get a little respite. We'll be more outdoors. I'm actually looking forward to warm weather. My son is graduating and I'd love to have a family dinner, but I'm not doing it right let me tell you, so hopefully that doesn't happen with your little baby, because this took a long time, but well appreciated by all the family. But yeah, I think that the latest variant that seems to be affecting a lot of the East Coast, we haven't seen too much of on the West Coast, but they'll continue to be that. You can see different countries like China being totally shut down and having resurgence episodes of infection. So I'm not going to be surprised if that happens. People, I'm sure, are working hard and fast to try to create a composite vaccine for fall that would be sort of like our annual booster. And I just think it's going to take a while for us to get where the infectious rates are lower. And really what it's going to take is that hopefully the comments that were made earlier are, we still will have some protection. So then if it comes along, we're either not going to get it or not going to get as sick. It's fascinating that the percentage of common cold has gone down since we've been vaccinated and been careful. So probably a combination of public health measures as well as vaccination, since common cold is a coronavirus. So I would just count on it and figure out how we can still live our lives around it. That would be my recommendation.
And has the hospital policy changed? I know I have a sister in a facility back east, and they're back to 2 visitors at a time, full masking. I'm wondering right now, is in Swedish, is it limited? And
yeah, we've never I don't think we've gone beyond 2 visitors at a time. And caution. And healthcare workers, I'm asking when they're at work. And I don't see that changing right now with high community transmission or moderately high community transmission. When that goes down, I'm just not sure what you're going to see in healthcare facilities. It's tough because masks, as you know, interfere with our human-to-human interactions a lot of, I mean, our eyes can say things, but our mouths and our smiles and all of those things say so much more. And certainly for hearing impaired and some other people, the inability to see the mouth moving is a big deal. So always thinking about those who are physically disadvantaged, as well as the race ethnicity disparities, and how this pandemic has hit everybody so darn hard with any limitations. Yeah.
thank you. Anyone else have a question for Dale or Salome?
I found the name of the organization I mentioned earlier. It's called People's Free Telehealth.
Okay. People's Free Telehealth.
And one of the people that are really advocating for it and supporting it is Dr. Morhoff Al-Aker. I'll put the People's Free Telehealth contact information as well as Dr. Aker's information into the chat box in case.
Great. Thank you. Yeah, free mental health is kind of unheard of. So, yeah. Okay. Any other questions for Dale or Salome? Salome, when you're in your practice, do you mostly see children, or is it a combination of both adults and children?
For me, it's really a matter of determining what can I do to be supportive. Who can I serve that will be able to live their life fully in the community, as well as continue to support the people that are looking to them that they're responsible for. And so I serve a variety of people of all ages. And I don't know if this is helpful, and I am going to send the Latinx Health Board and Community Health Board Coalition Wellness Toolkit out to everyone via you, Beth, that's okay. But it has a lot of resources in it, and different therapy organizations that you can reach out to and to see whether or not they're taking clients. And also some that are free to low cost, so that there is a wide range of support that can be provided.
Great. Thank you.
Can I
Yeah.
just jump in there for a second? So the person who is at 630-740-5683, can you just send us a message at info@healthadvocatex.org so we know your identity for the follow-up? Thank you.
It's Dale. I just want to thank Salome for coming and sharing so many rich resources and your own experience. Across our country, mental health has been separated from the rest of the body for way too long. We can't be whole without our mental health being whole as well and being good, being solid. And Washington State, unfortunately, is one of the worst states in the country for availability of mental and behavioral health services. We're working on it. I think it's slowly improving, but because of the way it's been carved out of hypertension and diabetic care and things like that, we have not paid real justice to the need for our whole bodies, mind, body, soul, all together to be treated. So really appreciate your hard work. Thanks.
So
Yeah.
Dr. Reesner, would you recommend waiting until the fall to possibly get a second booster or whatever they're going to do?
I don't have a strong recommendation. What I am going to do, because I'm going to be doing some traveling, is I'm going to go ahead and get it now. And then we'll see what the fall brings. And maybe that's a delay, or maybe, we'll see. I think with the Israeli study, it's helpful. I'm really looking forward to the long COVID, because I think that's what a lot of people are worried about, since the disease seems to be milder in those of us that are vaccinated. So my recommendation when people ask me is consider your own risks and then make that decision based on your own personal risks, either if you're immunosuppressed in any way, or if you're in the older population that has been shown to be more vulnerable to severe disease or death, hospitalization, all of that.
Okay, thank you so much.
Sure.
Yeah, and I noticed when we were in Chicago for the ICOPA conference, there's really not so many places that require to know that you're vaccinated. So really it's your own personal responsibility to figure it out and do that, because we were required for a while and now it's not necessarily required. So yeah. All right. Let's see. Anyone else? Yeah, we'll have to try to send up the resources in a follow-up. I just actually asked Sophie about that. And we send a survey out just after all of our events, but we'll send this separately so that you can have the resources that Salome put in the chat and don't have to be trying to write them all down.
By the way, I tried to look up the People's Free telehealth.org, and it's an expired website.
Oh,
So I am writing to the 2 emails there to ask them what's up and if they can give us more information.
thanks, Michael.
Oh.
Yeah. Well, thank you, everyone. We're a few minutes early, but I think that's okay. Everybody has lots to do today. Thank you especially to Dale Reisner, who always gives us great information. And thank you, Salome. And hopefully we'll stay in touch and people can contact you for resources. You are a wealth of resources, especially for mental health. So I'm really glad we were able to have you on today. And we'll look forward to you guys attending our next event, which is the networking on June 2nd. So everybody have a great day, and we will see you again soon. Take care.
Good to see everybody.
Okay.
Bye.
Okay.